When you're fixing your back pain, your shoulder pain, your hand, wrist pain, your knee pain, your hip pain, you may get a little bit frustrated that you have to exercise and keep moving and keep increasing your mobility and increasing your strength, or at least maintaining them, and it can feel like you're on this never-ending treadmill. And you might start to buy into this medical theory that if you have to keep doing something to maintain the good sensations, then it's not really a cure. I've heard doctors actually say, you know what? Back pain, if you exercise and it goes away, but then the pain comes back, then it shows that exercise isn't really a cure for the back pain. I've heard surgeons argue this for hip pain, for wrist pain, for shoulder pain. They keep saying, well, if you have to keep exercising, then obviously you're not fixing the problem. This is one of the most insidious misunderstandings of how the human body works. The fact that you can make aches and pains go away through exercise and movement shows that what we're dealing with is not damage, it's not structural issues, it's not something that needs surgery. It's showing that our bodies are communicating to us about its needs in the same way our stomach communicates to us about our body's needs. We don't consider hunger a pathological, undesirable state. It comes back often several times a day, and if we don't listen to that hunger, then our bodies keep talking to us, our stomach starts to hurt, other parts of our bodies start to feel weak, our brain stops working well. All these things happen as a signal that something is not going well and that we need to give the body something so that it feels right again. With joint pain, we're often trained by modern society to just immediately jump to this conclusion that there's something broken, when in fact our body is simply telling us something here is imbalanced, maybe something's too stiff, something is too weak, maybe something's too strong, or something's firing at the wrong time. By carefully using exercise, by gradually reprogramming our movement patterns, we're able to address the need, and that makes the pain go away. That said, if you don't consistently address that need, if you don't consistently groove in the good movement patterns and keep training muscles to maintain their strength and flexibility, you will end up feeling those signals that something is wrong. That doesn't mean that exercise isn't a cure, it just means there's no disease to begin with. That's why in all my videos and my programs, I remind you to always think muscles, because muscles are communicating with us about something needing to happen in order for us to move right. Once we figure out what helps us move right, we're able to feel right. And just like with our stomachs, if we stop feeding our muscles with the movements that they need, if we stop teaching our brains and our bodies how to move the body well, then we end up feeling the signal that something is missing. And that gives us the chance to correct it on a daily basis. So if you find yourself frustrated that you're not always making linear progress and that you're not getting a permanent fix without constant input of energy, you need to remember that it's because you're addressing a need. It's not that you're trying to solve some discrete disease. You're trying to build your body up gradually so that your body feels right because you're moving right.